Hello, everyone. I'm Dr. Marty Ross, and this is another Conversations with Marty Ross MD tonight. It's a webinar where we talk about Lyme disease. I'm interested in seeing what you have in store for me tonight because you create this webinar with your questions, and none of these are the same. So we'll see what curveballs you throw me, and I hope I can answer most of the things that you pass my direction. As you know, I use your questions. For those of you that attend here, as you know, I use your questions as a starting point to describe a number of things about Lyme disease and mold toxin illness. So just be aware I can get a little long-winded sometimes, although I'll try to keep them as focused as I can. For those of you that are new, welcome. And I'm also glad to see that there's a lot of familiar names on my message board tonight. The way you participate is two ways. Number one, you can listen to the questions, and I will read them out loud, and you can see what my answers are. So that's one way. Second way is to write your own question. You could do that by typing your question in the chat box, which is located at the lower right-hand side of the computer. Just write your question there and then hit the enter key to send the complete question to me. I ask that you only hit the enter key once the question is complete. If you try to do the enter key to create paragraphs, it sends multiple questions my direction, and it really gets almost impossible for me to figure out from this side. During the webinar, I will post your questions. For those of you that are in the live version, I'll post those questions on your screen, and you will be able to read them. But I'm also going to read them anyhow because people that participate in the recorded versions don't get the benefit of actually being able to see it on the screen. I am creating a recording of tonight's webinar, and if everything goes as planned, and we'll keep our fingers crossed on that because it usually does, but every now and then it doesn't. But if it goes as planned, I will have it ready to come out to you tomorrow morning, usually before 9 or 9:30 a.m. in the morning, often even earlier than that. So we'll see how all of my editing goes this evening, and my brief summary that I created that webinar goes as well too, as to whether I get that out to you early tomorrow morning or closer to that 9 or 9:30 time. All right, I think that's enough here. Oh, tomorrow morning when I do send out, I will send you an email announcing that the recording is ready for you to see, and it will tell you where to go find it. But if you happen to miss that email, you can always find the recordings of these webinars on the webinar page at treatlyme.net. That's Treat Lyme by Marty Ross MD on my webinars page. Scroll about halfway down, you'll see where the recordings are, and you can listen to it there, okay? But in that email tomorrow morning, I will also have a sign up for next week's webinar. This is one of 3 webinars that I'm doing this month, and they all begin now, okay? So sign up for next week as well, too, okay? All right, so without any further ado, let's go ahead and get started here. All right, hello, Alexander. Listen, hello, Dr. Ross. I tested positive for trichosethine mycotoxins via real-time labs. I saw on your website that you recommend activated charcoal over cholestyramine to treat this specific mold toxin. I have recently ordered activated charcoal through your store and would like to know the following. How many pills or milligrams do I take daily? Is it better to take it in the morning or evening, empty stomach, or a meal? Should I continue my daily supplements or stop any of the following? And then you list out those what you're taking, which is probiotics, curcumin, glutathione, vitamins C, D, and zinc. All right. So let's look at that. So first of all, what Alexander's talking about, everyone, is that he's got mold toxicity. And one of the ways that you can test to see if you have too many mold toxins in you is to do a urine test. And if you happen to be peeing out excessive amounts of toxins, it means they really are in you, okay? Now, there's a number of practitioners out there that also follow a different way of approaching this, which is to follow what is known as Dr. Richie Shoemaker and the Shoemaker Chronic Inflammatory Response Syndrome Protocol. And Dr. Shoemaker does it a different way that doesn't fully work when you have Lyme disease. And what the Shoemaker way is to see if you have enough symptoms that look like mold toxicity, and then he would have you do a bunch of blood testing to see if you have a genetic predisposition to have the problem, and if you have enough inflammation blood markers. And if you do have those inflammation blood markers and you have the genetic predisposition, he automatically assumes that it's mold toxin illness. The problem with the Shoemaker approach is a lot of the inflammation that mold can cause can also be caused by Lyme. So all those inflammation markers he's looking at may not really be off because of mold. Maybe they're off because of Lyme in a person, okay? And a second problem is that his genetic test to see if you have genetic predisposition. Having a genetic predisposition does not mean you actually manifest what the blueprint tells you to have, all right? So if your genetic code says you're supposed to have a mold detox problem, there doesn't mean you always manifest it. There's a lot of influences on what happens after that genetic code as to whether a problem develops, all right? So most of us that work in Lyme disease, because we know that the Shoemaker testing is very unreliable when it comes to mold toxicity in Lyme disease, we prefer to actually measure, are those toxins really in you? And the way to do that is with a urine mycotoxin test. And this one by Real-Time Labs is one that I use. I tend to prefer it these days over other options that are out there as well too, okay? All right, so you're seeing that you have trichocetin, which is, everyone is black mold toxin. Boy, I don't know what's going on. My lighting here is not working tonight. I see it flickering all over the place. At least on my side it is. Let me see if I can get it so it's a little more consistent here. I hope that works. Anyhow, in terms of what do you do when you have elevated mold toxins? Well, it all depends on which ones are elevated. In this case, trichocetin is something that can be removed using what are called binders. And you can either use something called cholestyramine, which is a prescription that works against, it's a prescription medicine that works, is designed to treat high cholesterol, but it does work for this condition. Or you can use natural binders. And in this case, charcoal is one that works well. Okay, so why do you use binders? Well, let's talk about that real quick. All right, so what's supposed to happen if you don't have this genetic problem, what happens in most of us, 75% of us, do not have mold toxicity issues. And the reason is that our immune systems are designed to see mold toxins. Some of those cells will see the mold toxins, come in and tag them, and then other cells will come in and break down those mold toxins. Okay, so that's what is supposed to happen. Okay, now if that doesn't happen, those mold toxins then go to the liver, and the liver is not able to break them down and moves them out into the intestines as a fat-based mold toxin, and then out in the intestines they get reabsorbed again. So you just get this endless loop of toxins going round and round, basically, okay? So you want to remove them, and the way to do that is you grab hold of them out in the intestines where you get the chance to get at them. And you do it with something that's going to act like a sponge for them, in which this case is the activated charcoal, okay? Okay, so in terms of the activated charcoal or any binders, well, this one in particular, what I like to do is I like to have people take a 500 milligram pill of the activated charcoal, which is what you probably ordered from my website, and you take one pill one time a day. And after 7 days, if you don't see that you're flared up from it, then you can go up to 2 pills one time a day. And sometimes I will work people up to 2 pills twice a day. And so the way that would happen then is after you're on 2 pills, you then go up to 2 pills in the morning, 1 pill in the evening. And then 7 days later, if you're tolerating that and you're not all flared up by it, you can go up to 2 pills twice a day. Okay, so that's the way that you wind up going ahead and doing it, all right? All right, so then in terms of timing on it, and this will answer the question you're having about whether you should stop certain things as well too. So you got to be careful with binders because they bind things, all right? And so you want to make sure that they're not going to bind up all your medicines. So what you need to do with your binders is there is a 2.5-hour window around when you take the binder that you do not want to take other things, all right? And that 2.5-hour window begins 30 minutes before you take your cholestyramine or your activated charcoal or your bentonite clay or your GI detox. Those are all binders, okay? So 30 minutes after you stop things, and then 30 minutes later, you take your binder. And then 2 hours later, you can start taking things again, okay? So that's your 2.5-hour window. So stop all your supplements, stop all your prescription medicines beginning 30 minutes before you take your binder, and then you can resume them 2 hours after your binder. Okay. All right. Now, food is a different issue. So you can actually eat any time when you take your binders. The ideal time to eat something, even a small amount of something, is 30 minutes after you take your binder. And the reason that that is the ideal time is that whenever you eat, it causes your gallbladder to contract, okay? And when the liver processes these toxins, it stores some of them in your gallbladder while it moves the rest of them out into your intestines, all right? Now, when you take a binder, about 30 minutes later, those binders will have worked their way downstream to the area where the gallbladder squeezes its stuff out. All right, so that area of the small intestines. That's why you wait 30 minutes to eat a small amount of something, okay? All right, so that's a lot of stuff I just said, but I hope that kind of gives everyone a framework here. I'm going to do a quick screen share where I can show you an article that I've written all of this down with some detail, including, I think, in there about how you take your activated charcoal in terms of dosing too, okay? Let's see if I can pull that up here. All right, so this is my Lyme information site. I think you're all familiar with this. This is, and here you can find my online Lyme guide, and you would want to take a look in my section called detoxification, and then take a look at my article called Mold and Lyme Toxin Illness. And then you want to scroll all the way down here, and I review testing, I review like urine testing and all that. And then I also talk with you about the different binders that you would use depending on which toxins you see. And then in terms of how to do the activated charcoal, I describe it here. Okay. All right. All right. Alexander, I hope that answers your question, and good luck to you. Hello, Jim. Let's see. Would standard oregano oil be a useful substitute for liposomal oregano oil for BART? Or if you don't use the liposomal, is using an oregano oil better than using standard oregano oil? Also, what is your current thought on using ivermectin for COVID? I'm laughing because ivermectin. I'll come to ivermectin here in a minute. So regarding oregano oil, I prefer liposomal. What liposomal means, everyone, is that the oregano oil is microscopically wrapped in fat to increase its absorption into your bloodstream. And the reasons that we use oregano oil, or I use it these days in my practice, is based on research from Johns Hopkins University showing that it can treat both growing and persister forms of Lyme, growing and persister forms of Bartonella, okay? So in the world of Lyme disease, a lot of our treatments have changed over the last, I guess, 5 years for Lyme and over about the last year for Bartonella, and that we now have research showing that one of the reasons, not all of the reasons, but one of the reasons that some people have a hard time recovering from Lyme and from Bartonella is that the germ actually has two growth states. There's growing Bartonella, and there's a hibernating form called a persister. Same with Lyme. There's growing Lyme, and then there's a hibernating form called a persister, okay? And probably about, if we look at some of the research that's been done, maybe about 10% of these germs will go into a persister form, but it may be what is keeping somebody ill if we can't get at those. Standard prescription antibiotics do not work against those persisters, okay? So Johns Hopkins has been able to show that oregano can help. And so that is one of the treatments that I do, okay? So liposomal is the best because you get it absorbed into the bloodstream. If you cannot tolerate that, I do have some benefit with people just taking oregano oil drops. I sometimes will have them use a product by Gaia Herbs, and I'll have them work up to about 5 to 10 drops twice a day. Okay. All right. Now, ivermectin. So ivermectin is and the reason I chuckled is I just sent out an article last week about my thoughts on getting COVID vaccine, and I strongly support getting COVID vaccine. And believe me, I got skewered by so many people in the world of Lyme that thought I was nuts for that. But here's why I'm for that. COVID kills. COVID maims people. COVID causes serious health problems. And to date, the only drug or anything we have out there that has proven benefit at stopping all that disaster from COVID is the vaccine. Okay, that is the only thing that has been shown to make a difference in this illness. And basically, as I've used it with my patients that have Lyme disease, I have seen no ongoing long-term problems occur in 99.99% of my people. In addition, there is research that has been done by LymeDisease.org and their My Lyme Data Project, where they've been able to show that people with Lyme that got the vaccine are having no worse time handling it, have the same side effect outcomes as people that don't have the vaccine, okay? And then I know I hear a periodic argument from people with Lyme that say, I've got too much immune suppression going on. I don't know if I can handle the vaccine. Well, that's exactly why you want to get vaccinated, because you need to boost your immune system to fight this COVID, okay? All right, now, among the anti-vaxxers that are out there, there is an opinion that they don't need to use the vaccine because ivermectin will save the day. Okay, so what is ivermectin? Well, ivermectin is an anti-parasite medicine that is approved to treat parasites, okay? That's what it's approved to do. And in laboratory experiments, it has been shown to possibly block the replication of COVID. And for that reason, a number of people started using it. There is a very vocal group of physicians that I call cheerleaders, because they have taken on the mantle of trying to say that ivermectin can save the day. And they have created a number of research projects, some that are published in peer-reviewed journals, the majority that are not published in peer-reviewed journals where any of us can take a look at the data, and a number of them that just aren't published. And they've scrutinized all that data and done their own what's called meta-analysis of this data that cannot be verified in many instances. And they've said that it shows that it can be beneficial for people that get COVID as a treatment for COVID. And then based on some population studies, again, that have very poor data, poor design, they also have tried to say that it might be a useful preventive to keep you from getting COVID if you were to take it regularly, like twice a week or once a week, okay? What I can tell you is I've looked at that data. It's horrible data. It is not trustworthy science, because the majority of researchers that have created this data have strong bias to try to prove to you that what they believe works, all right? They're acting as cheerleaders, okay? And I don't trust the data on that. So you have a proven treatment, which is the vaccine, versus really an unproven treatment in a world where COVID-19 and the Delta variant have gone crazy. I think the best thing to do is get the vaccine. And yes, even for people with Lyme disease, okay? And then one other point, a few other points. The reason I really support it strongly right now, especially with the Delta variant, is this Delta variant is extremely infectious. And that's for a couple reasons. Number one, it attaches to the membranes of your nose tissue a lot stronger. And one of the writers that I quoted in my article suggested that if that basically, I think he used a comparison that old COVID would be like using Elmer's glue to stick to something, versus this COVID is like doing Gorilla Glue. Okay, so this stuff sticks. In addition, it creates many more copies of itself, so that people that get this in their nose passages are loaded with a lot more of it, okay? And that for that reason, they can spread it even to the vaccinated, okay? Now, even though they can still spread it to the vaccinated, that vaccine is still showing that it can keep you from getting in the hospital, and it can keep you from getting bad illness, all right? that doesn't mean we're still not getting it, okay? And so even if you're vaccinated and you're in an area where there's a lot of Delta variant these days, it is a good idea to still wear a mask so you don't get hit with this super infectious variety and then it will take hold up in your nose, okay? And then I'm going to say something that I am sure I'm going to get emailed at like crazy beginning tomorrow because the anti-vaxxers are just rabid in their approach, okay? So first of all, I just want you to know, I wrote my article supporting the vaccine for those that are on the fence or those that have already gotten the vaccine or are wondering, what are we seeing, okay? That's who I wrote the article for. I did not write it for an anti-vaxxer because there is nothing I'm going to be able to say to an anti-vaxxer, given the rabbit hole of ideas that you all have gone down, that is going to convince you to get a vaccine. So I give up. I just give up. I will tell you, though, that personally, I am upset with all you anti-vaxxers because what has happened is the fact that you have not gotten vaccinated if you can. And there's a rare person with Lyme that may not get the vaccine, that should not. And that's things you need to talk with your existing healthcare provider about, okay? But the majority of people with Lyme and the majority of people that are out there with other problems can get the vaccine. And if people would gotten the vaccine, the Delta variant would have not had a place where it could go. And all of us that got vaccinated now would not be at risk too, okay? So it's this anti-vaxxer movement, in my opinion, that has made it worse for all of us that were responsible and got a vaccine to protect ourselves and protect our neighbors. And now we're at risk because of these people that have refused to use a very effective medicine, okay? Now, I admit, I can only imagine what's going to happen in my emails tomorrow, and I'm going to be skewered for everything I just said. But again, I'm making my comments more to the people that are on the fence about getting the vaccine, and also the people that have gotten the vaccine, so that you know that what we're seeing is it's actually safe. Okay, and then let's see one other thing. Oh, there are some people that have written me in the last week saying, well, I had Guillain-Barré, I had severe neurologic condition that developed. I shouldn't get the vaccine. And I would say probably not. There are some situations for people with Lyme where if you've had a bad outcome, you have a severe neurologic condition caused by vaccines before, or maybe Guillain-Barré, maybe you're not an appropriate candidate for getting the vaccine. But you need to discuss that with your physicians so they can help you make a decision about that. Okay? All right. So let me do a quick screen share for you so you can take a look at this article I wrote where I document all of this, and I even refer to places you can look at to get more information, especially if you're on the fence about getting it, okay? And if you're on the fence about getting it, I get it. Take a look at it, consider, see if it's for you, but recognize what I'm seeing in my practice is people are not harmed in an overwhelming way by this vaccine. And I see in my practice of Lyme disease patients that it is actually a safe thing to do. And no, I would not trust my healthcare to Ivermectin at all. I would not trust it at all. Okay. All right. I hope I made that clear. Let me go ahead and do a quick screen share here. All right, so let's see here. Take a look at my latest, the section called The Latest. And here is my article about COVID vaccine and Lyme disease, okay? And I even talk in here about some things you might want to do to, so anyone that gets the COVID vaccine is going to have a flare in cytokines. And as many of you know, what gives you Lyme symptoms are excess cytokines. COVID vaccine triggers excess cytokines too. And that's a good thing with COVID because it's those cytokines made by your white blood cells are training your immune system to become immune against COVID, okay? We want that to happen, all right? So you may have a cytokine flare that's going to give you more fatigue, will give you achiness, may even give you more brain fog. But again, what I'm seeing in my practice is that's very temporary for people with Lyme. It's the same thing that happens with people that don't have Lyme. And in here, I talk about what to do about that, okay? All right? All right. All right, I'll come off my pulpit here. All right, Jim, thank you for that. Hello, Chris. Hello, Dr. Ross. Thank you for all you do. You're welcome. Let's see. What can you tell me about tactile delusions, hallucinations in a 24-year-old person who has Lyme Bartonella babesia for 10 years and is still very ill? She believes that she has very long hairs wrapped around her whole body. They move around and are attached to everything in her house. They cause her great pain, discomfort, anger, and frustration. She cannot touch anything for fear of getting more entangled. This began about 6 months ago and has been getting progressively worse. She can be very lucid and normal when she is not talking about the hair. Do you have any treatment suggestions? Chris, I'm sorry about that. I would say treat Bartonella, number one. And so I have a whole article that outlines the ways that I approach treating Bartonella. So get the Bartonella under control. But in terms of, she would also probably benefit from some psychiatric medicines. And I wouldn't consider myself an expert on the psychiatric medicines to use in this area. So I don't have ideas for you on that, but a psychiatrist should be able to help her with those kind of medications. Okay. All right. So if you're looking for ideas on how you treat Bartonella, let me just do a quick screen share here for you. So one way you could find that article is go to my infection treatment plans here and take a look at this article called How to Treat, wait a minute, I'm sorry. Take a look at this article called Kills Bartonella, a Brief Guide, okay? All right, good luck to you, Chris, thank you. Or to your friend too, I should say. Hello, Tara. Let's see. Does herxing and feeling crappy during a yeast overgrowth treatment confirm you indeed had too much yeast? If yes, what if you don't herx? Does that mean you didn't have a yeast issue? Will fluconazole alone get rid of it? Lastly, do you only treat for a max of 30 days? Okay, so everyone, just to make sure we're on the same page, let's talk about what a Herx reaction is first, okay? So a Herxheimer reaction or a Herx reaction is a worsening that occurs right around the time that you start a new antibiotic or antimicrobial, all right? And what happens in this is the immune system sees the dead germs and reacts by making more cytokines, all right? I've mentioned cytokines a number of times tonight, so let's talk about cytokines here real quick. So white blood cells, whenever they see an infection or a mold toxin in you, or too many yeast or Lyme, whatever they're seeing in you, some of the white blood cells will manufacture cytokines. And cytokines are good and bad. On the good side, in the right amount, they turn the immune system on. They cause it to make antibodies. They turn on cells that fight infection, and they draw them to where the infection is, okay? All right, that's the good stuff, all right? But if they're having a hard time getting rid of an infection, they will wind up reacting and they will wind up making too many cytokines. And too many cytokines give you brain fog, make you hurt, give you fatigue, interfere with how your hormones work, can disturb sleep, make you hurt. You get the idea. I mean, what we call Lyme disease symptoms or what we call mold toxicity symptoms, they're actually excess cytokine symptoms, okay? All right, now, when you start killing germs, then one of the things that can happen is the immune system will see those dead bug parts and make more cytokines, all right? So that's why you get a worsening of all of your symptoms, all right? Now, in my experience, treating both yeast and treating Lyme, there's about probably 80 to 90% of people do herx when you go on something that's working, but about 10 to 20% don't. And so not having a herx does not prove it's not working. It still could be working, okay? So you don't have to herx to get better, all right? Now, in general, when I use fluconazole as a way of treating for too many intestinal yeast, the way that I like to use, I like to treat for 30 days. And my preferred way is to combine it with nystatin. Nystatin is also a prescription anti-yeast medication. It is generally non-toxic. It sits just in the intestines. It doesn't get absorbed into the bloodstream, so it's actually safe to do, all right? The reason I include nystatin is I see better outcomes with it, but also we're increasingly seeing a problem where yeast are learning resistance to diflucan and medicines in that family. And my experience is that when you use nystatin combined with it, you have better outcomes, okay? So I like using the two together. So you could do nystatin, 500,000 international units, 2 pills twice a day, coupled with a diflucan, 200 milligrams, 1 pill a day for 30 days. And then once you're done with the diflucan, if you're doing better, I would still continue the nystatin, especially if you're still on antibiotics, or if you're off antibiotics, I still continue it for about 3 more months to prevent the yeast from coming back, okay? Now, during that time, you also want to stay on probiotics. So while you're treating yeast actively, and then when you're trying to prevent their return, you want to stay on probiotics as well too, okay? Now, an alternative to the nystatin that you can couple with diflucan would be an herbal option. And you could do herbal medicines that include more than one of the following, but it doesn't have to be all. So things that would be in an herbal compound can be things like powder co, caprylic acid, rosemary oil, thyme oil, oregano, grapefruit seed extract, caprylic acid. Those are all things that you can find in anti-yeast combinations. So for instance, at my store, Marty Ross MD supplements, you can find a product called Capri Plus, and that's made by a company called Karuna. And that has in it a caprylic acid, garlic, and oregano oil, okay? And I like that. It's a pretty good combination. I usually have people take that as 2 pills twice a day, and then you can combine that with the diflucan, for instance, okay? You could do it as an alternative, for instance, to the nystatin. Alternatively, you could even use like a Capri Plus to get rid of your yeast, but I find it takes about 2 months and it works 80% of the time, versus I find in my practice that a diflucan nystatin combination works effectively about 90% of the time. It usually takes about a month, okay? All right. Good luck to you, Tara. Thank you for that question. So if any of you are looking for alternatives to treat yeast, let me just do a quick screen share here for you on that. All right, so there's 2 ways you can find what to do about yeast. You could either look in my infection treatment plan section here and you'll see the article, or I have a whole section just on yeast, okay? And so in terms of trying to figure out if you have yeast, you could look at this article called A Silent Problem, Is It Yeast? And then in terms of what do you do about yeast, you can take a look at this article here called Kills Yeast, A Brief Guide, okay? All right, let's see here. Hello, Justin. Hold on here just a minute, Justin. Let's see, what are some of the symptoms of alpha-gal? Thanks. So alpha-gal, I guess I wouldn't call myself one of the best experts on this one, to be quite honest with you. I know that it is, I believe it's an allergic reaction that people are having to eating beef after they get a tick bite, I believe, from the Lone Star tick, but I'm not seeing it enough to be able to give you comment on all of that it entails, because I just don't have anyone in my practice that's been having that problem, okay? So I apologize for that, Justin. Good luck. Hello, John. Hello, Dr. Ross. Have you read or experienced within your COVID positive patients how the Regeneron monoclonal antibody treatment affects Lyme patients? Is it the same as general population or different for us? Thoughts? Thanks. So I don't know. I honestly don't know. I have had some patients in my practice that have gotten it. I honestly don't know how their outcome actually compares to people that have that don't have Lyme that get it. Okay, so I don't know. All right. Thanks, John. Good luck to you. Hello, Ruth. Let's see. Hi, Doc. I have two questions. First, how long after a bite should one be tested for tick-borne illnesses? And second, my sister was bit by something, had a rash that looks sort of like a bullseye. It didn't expand, was gone 24 hours later, and no flu-like symptoms. Did have a runny nose and sore throat 48 hours later. What would you recommend she do? Okay, so in terms of when to test, the problem, so the testing we have, which is basically antibody testing, whether you do the CDC approved method, which is to get a blood test for Lyme that will do a test called an ELISA first, which is a screen to see if you're making your immune system is making antibodies against Lyme. And if that's positive, then you confirm that those antibodies really were made against Lyme by doing a Western blot. So that's an antibody test, okay? Or those of us in the Lyme world prefer to do a Western blot test through IGeneX. That's an antibody test too. Antibodies can sometimes take 2 weeks to a month to develop. So at a minimum, I would wait 2 weeks. And so if you're really, the thing about that, if you're waiting on that kind of a test, if you really think there's a high possibility of Lyme, you need to get treated right away, even while you wait for those test results to come back, okay? So in other words, I would wait a minimum of 2 weeks before you even get the test if you just had a bite, for instance, okay? But in that meantime, if there's a high risk that you could have Lyme or gotten a tick that had Lyme, then you ought to start treating in the meantime, all right? Now, regarding your sister, so, your sister doesn't know what she was bit by, and ticks are not the only thing that can give you round red rashes, okay? So in this kind of a situation, if she didn't see a tick, has not had ticks on her, and she's not having a temperature or flu-like symptoms, I would probably just wait and watch. If you were really concerned, in about 2 weeks, she might want to get a Lyme test done, okay? That's how I would approach that if it was somebody in my practice, okay? All right. Thanks for that question, Ruth. Let's see. Is there evidence that hormone imbalance and hypothyroidism make overcoming Lyme harder? So I would say we don't have laboratory evidence of that, if that's what you're asking. Is there research that shows that? I can tell you that when I've had patients that I eventually figured out they had low thyroid, either by testing or by clinical symptoms, and they weren't doing as well, and then I added thyroid medication in, they often do better. Okay, so from a clinical experience standpoint, I can tell you that. The other thing we know is that these excess cytokines that I were telling you about can interfere with the brain sending signals to the thyroid, telling it to make the right amounts of thyroid, okay? So the brain cannot correctly interpret the thyroid environment to send out TSH, which is thyroid stimulating hormone, to your thyroid, telling it to make thyroid. And because it can't correctly interpret your thyroid, it makes erroneous amounts of TSH that may not reflect what is actually happening to a person. So you can kind of think of it as the part of the brain that's supposed to interpret this, the hypothalamus pituitary, kind of gets drunk on cytokines, and it just doesn't provide a correct interpretation, okay? So many of us, when we're trying to consider in the world of Lyme, if somebody has low thyroid, we do look at a TSH level. And we also will look at T4 and T3 levels, which are the two hormones that are thyroid hormones made by the thyroid gland. But in addition to looking at what the blood testing tells us, we have to look at what clinically is happening to the person too. So in my practice, if somebody has got a lot of clinical symptoms of low thyroid, even if they have TSH and T3 and T4 that are normal, as long as their T4 and T3 have room to be increased within the normal range. So let's say normal T4 is 1 to 2, 0.5 to 2, something like that, okay? And they're sitting at 0.75, I know I can give them more and still keep them within normal range on that T4, okay? All right. So if somebody has a lot of symptoms of low thyroid, then I might treat. And so those symptoms are cold intolerance, dry skin, hair loss sometimes, and sometimes with by the cold intolerance, I mean you're the person that's having to wear multiple layers compared to everyone around you to stay comfortable, either in air conditioning, if everyone else is comfortable in air conditioning and you have to do multiple layers, that probably means you have cold intolerance, okay? Or when it gets cold out, if you have to do multiple layers to stay comfortable, that can sometimes mean cold intolerance that we see too, okay? Dry skin can sometimes occur in low thyroid as well too. So you got to look at clinical symptoms and make a decision whether you're going to treat, because we know cytokines interfere with the brain giving correct direction. Okay? All right. Thanks for that question, Nolan. Hello, SI. Hold on here just a minute. Number one, can penicillin, bicillin treat intracellular Lyme? The answer to that is no. So bicillin, which is a type of penicillin, works in what is known as the extracellular space outside of cells, okay? And the problem is we know that Lyme can live in the extracellular space outside of cells, but it also can get inside cells, or we call that the intracellular space. Penicillin, bicillin, is good at treating extracellular Lyme. And one of the ways it works, or the way that it works, we think, is that the mechanism by which it works is that it prevents the spirochete Lyme from repairing its covering as it gets injured. And because it can't repair its covering, it effectively develops holes in the covering. And as it grows, it bursts, okay? Because it doesn't have a covering to hold it together, basically, okay? So, but that penicillin does not get into the intracellular space, okay? All right. Let's see. Is it bad to combine azoles and tetracycline antibiotics? No. So azoles, everyone, would be things like fluconazole, which is used to treat yeast, itraconazole, used to treat yeast, or azoles would be metronidazole and tinidazole that are used to treat the cyst form of Lyme. They also get in the intracellular space, okay? And tetracyclines, which seem to be useful against spirochete Lyme living inside and outside of cells too. You can combine them together. I do all the time in my practice. Number three, a friend in her 20s who works outdoors in Ontario got mystery symptoms in August with joint pain, headache, high fever, heart inflammation, weak limbs, and throat issues. She saw 10 plus doctors. One doctor diagnosed her with Still's disease. I told her to get tested for tick-borne infections. They already have her on steroids and prednisone. If she does have Lyme and co-infections with the steroids, or will the steroids have ruined her chances of getting better? Her white blood cell count is very high and fever comes and goes. So the issue with steroids, everyone, oral steroids or IV steroids, is that systemic steroids like that can suppress the immune system, and they can make it so that without the immune system keeping the Lyme in check, it can take off. You know, it makes it harder to treat Lyme and co-infections if somebody's been on steroids before, but it's not impossible. a number of people I've treated in my practice that have had tick-borne infections that had been put on steroids, and it made our job more difficult, but we were still able to help those people. Okay? All right. Thanks for that question. Hello, Brandy. Let's see. Suggestions for neck instability. Seems like infections hang out in the brachial plexus going up to the atlas. So, Brandy, I mean, obviously with this whole thing, treat your infections, whatever they are. The other thing you might talk to your provider about is seeing if you can work with a physical therapist who could come up with a strengthening program for you, or might be able to help look at ways of bracing your neck as well, too, if that's what's needed. Physicians that also kind of work within that realm that might be able to give you some ideas are known as physiatrists or PMR physicians, physical medicine and rehabilitation medicine physicians. Sometimes they would have some either strengthening or bracing methods that might be able to help you, okay? But regardless of what the cause is, let's go after your infections. Try to get those under control so that you're not having the weakening from that, okay? All right. Good luck to you. Hi, Amanda. I'm sorry. I really don't read these before I put them up. There's sometimes I will look at a long one just to see if I can post it. But so anyhow, hello. Hello, Thomas. Let's see. Do you recommend anything for profound muscle weakness? Yeah, I mean, a few things. And this is without being able to take a detailed history on you. So I would need, for your specific situation, I might have some different ideas. But just that general question, what do you do for profound muscle weakness? Number one, muscles need magnesium to work, okay? So I often will want to have people take magnesium. I like using either magnesium malate or magnesium citrate, and I'll have them take anywhere from maybe about 300 milligrams a day. Okay, that'd be one thing. You can take it at night, especially if it makes you sleepy. That's a good way to do it. Number two, when I hear of profound weakness, I have to wonder if there has been some injury to the mitochondria. So your mitochondria are the energy factories found in every one of our cells. By some estimates, there's 300 to 400 mitochondria in a cell. And inside mitochondria is where sugar and fat are burned through a bunch of chemical reactions to create cell fuel, okay? And that cell fuel is something called ATP. Now, when you have chronic infections or you have mold toxin illness, the chronic infections cause a lot of extra or oxidizing agents to be made by the immune system that can damage the covering. Mold toxins do too, and the mold toxins themselves may be directly injurious or cause injury to the covering of the mitochondria as well too, okay? If that covering of the mitochondria gets injured, it can no longer take fat, one of the fuels, into the mitochondria to be burned into cell fuel, okay? The other thing that happens if the mitochondria gets injured is one of its jobs is to provide electrons to all these chemical reactions. And if it is injured, it cannot release these electrons into the mitochondria for the chemical reactions. And so you get sluggish energy generation as well, too. So one thing if you were a patient of mine and you had that, I mean, again, I would want to do a much more extensive history on you to figure out if there may be something else going on. But in general, what I would do is mitochondria repair. And there are two essential things I would do. Number one, I would want you to be on glutathione. Glutathione is a very powerful antioxidant that can help start fixing the mitochondria from the inside. And if the mitochondria has been injured, it may have burned out its glutathione gas tank, okay? So the form of that I like is a liposomal variety. Liposomal means it's microscopically wrapped in fat to increase its absorption. And the liposomal variety that the product I like is made by Research Nutritionals. It's a product called Tri-Fortify. And I would have a person take 5 milliliters 1 time a day. Okay, now they've got good data. Research Nutritionals has good data showing their product is very well absorbed. Okay, and that it actually increases levels in red blood cells, which is what they studied. It really increases intracellular levels looking at those red blood cell levels. All right. Second thing I would do is I would want to repair the fat membrane of the mitochondria. Remember I said that gets injured. So the product that I like using for that is a product called ATP 360 by Research Nutritionals also. You would take 3 pills 1 time a day, and it's made up of the fats, a proprietary mix of fats that is been shown to repair the mitochondria membrane. In addition, there's some micronutrients in it that help your mitochondria work. Okay, now there's one situation where you would not want to take the ATP 360, and that is if you are taking atovaquone, Mepron, or Malarone, all which have atovaquone in them to treat your babesia. You do not want to take ATP 360 because it has something called coenzyme Q10 as a micronutrient in it, and that coenzyme Q10 can interfere with the functioning of the atovaquone. All right. If that's the situation, rather than doing the ATP 360, I would have you use another product by Research Nutritionals, which is called NT Factor Energy. It has nutrients in it to help your mitochondria. It also has the fats, but it does not have coenzyme Q10 in it. Okay. All right. So the 2 essential things would be to repair the membrane covering either with ATP 360 or NT Factor Energy. And the way you use the NT Factor Energy is 2 pills 3 times a day. Or you would, if you are on atovaquone, you would want to take NT Factor instead. Okay. And then you want to be on glutathione. All right. And then one other point. If you are a vegetarian, it does not have any meat, either fish or red meat, then you may be deficient in something called carnitine. Carnitine is a chemical that you get from red meat that is used as the transport vehicle to carry fat to the inside of your mitochondria. So you could be carnitine deficient. So if you are experiencing what's happening with you, muscle weakness, and you are vegetarian, not having any red meat, and that could be red meat could be lamb or could be beef. In that case, then I would suggest also taking some carnitine, and the product I like for that is called acetyl L-carnitine, and that's a 500 milligram pill. You start at 1 pill twice a day, and then after 30 days, you go to 1 pill a day. Okay, and the product that I like for that is manufactured by Thorne, and it's their product called Carnitine. Okay. All right. So I hope that gives you some useful insights. Let me show you a quick screen share of a article I've written about how to repair your mitochondria so that you could go ahead and look at that and get more information. All right. So take a look at this section called Energy and Fatigue. And take a look at this article called How to Fix Mitochondria and Get Energy in Lyme Disease, okay? All right. All right, good luck to you, Thomas. All right, hello, Robert. Hi, Dr. Ross. Thank you for all you do. 10 years with Lyme, 2 questions on supplements. I started on liposomal glutathione, curcumin, and ATP 360. I seem to be tolerating after a week. Would you recommend adding quercetin to also block kinase enzymes, or are they getting blocked with what I'm taking? Number 2, for Persister Lyme, I'm taking cinnamon, clove, and oregano, grapefruit seed extract, cat's claw, and 300 milligrams of doxycycline pulsed 4 days on, 3 days off. I'd like to add Cryptolepis. Would Crypto Plus be a better choice? Thanks. Okay. All right. So first of all, for your first question, so the quercetin that you're wanting to try as part of I think what you're doing with the liposomal glutathione, curcumin, and ATP360 is you may be doing mitochondria repair, or you may be doing nerve repair. So if you're doing nerve repair, in addition to the glutathione ATP360 that I just mentioned, I like to get nerve inflammation down, all right? And one way to do that is with curcumin, and curcumin gets inside of white blood cells and through a number of mechanisms decreases their production of cytokines. But it's not as big of what's known as a kinase inhibitor as quercetin, okay? Quercetin gets inside of white blood cells also and decreases cytokine production, but does so in a number of ways, but the big one is by blocking enzymes called kinases that help produce cytokines, all right? So kinase, cytokines, okay? Kinases are enzymes used in making cytokines. So you could get an added benefit by adding quercetin in. There isn't anything else that you're mentioned here that works quite like it, but I will tell you, you're on a pretty effective regimen. That glutathione and curcumin are also both anti-inflammatory. In addition to glutathione is repairing things, okay? So I'm not sure that you would need the quercetin, all right? And then in terms of persister Lyme, so just so you know, the things that you're on that are truly treating persisters would be the cinnamon, clove, oregano, and maybe cat's claw. Cat's claw's got some evidence that it can treat persisters based on Johns Hopkins research. Pulsing the doxycycline may help with persisters, because what happens is in the periods that you're on doxycycline, some of the growing forms of Lyme will go into a persister state. And as you stop the doxycycline, they'll pop back out and become a growing form. And that way you can use the doxycycline to kill the growing form. Okay, maybe that works. I actually haven't seen great benefit in that kind of pulsing, but maybe it would, okay? In terms of cryptolepis, my preference would be to use a pure cryptolepis product rather than Crypto Plus. So the Crypto Plus has a number of other germ killers in it in addition to cryptolepis. And what you really need for treating persisters is pure cryptolepis, okay? So I would save your resource, save your money, and go for just a pure cryptolepis product, okay? All right. And if you're to do pure cryptolepis by itself, I would do 5 milliliters 3 times a day, a teaspoonful 3 times a day. Okay. What am I talking about cryptolepis, everyone? So Johns Hopkins University has been doing some really novel studies here over this last year, and they've now been able to tell us that cryptolepis, which has traditionally been used to treat Babesia and malaria, actually is pretty good at killing, at least in a laboratory experiment. Lab experiments are not humans, okay? But at least what we see in laboratory experiments, cryptolepis seems to do a good job of killing growing forms of Lyme, as well as persister forms, and it seems to treat growing forms of Bartonella and persister forms of Bartonella too. All right. So I've been working with it in my practice and seeing some benefits. I think it's really too early to tell if it's going to be a game changer for everyone, because this is newer research, but we'll see. We'll see if it does. But I would choose a pure cryptolepis product over a Crypto Plus, okay? So for instance, on my website, the pure cryptolepis product you can find right now, I've got a product by a company called Elk Mountain Herbs. I also have a product by a company called BioPure. Either one of those would be good products, okay? All right. Good luck to you. So everyone, if you're wondering about persisters, so last week I actually produced a couple new articles, and one of those was that article on the vaccines that I showed you already, but there was another one, I believe it was last week or maybe it was 2 weeks ago, that I created about what do you do about persisters. And it's this one called How to Treat Persister Lyme and Bartonella. And I review a number of ways to do that, including using the cryptolepis, Japanese knotweed, disulfiram I talk about in here. And I also talk about dapsone. There's a variety of things you can look at, okay? So take a look at that article here, okay? All right, Robert, good luck to you. Thank you. Hello, Julia. Hold on here just a minute. Let's see. Hi, Dr. Ross. I tested positive for Bartonella and Lyme. I have sharp pain all over my body. I've been sick for 7 years, but just got it 2.5 years ago. Wait a minute, let me read this again. Hi, Dr. Ross. I tested positive for Bartonella and Lyme. I have sharp pain all over my body. I've been sick for 7 years, but just got it 2.5 years ago. It went away for 4 months, then came back to stay. My symptoms seem to rotate every couple months. Have you seen this go away or improve a fair amount with treatment? Thank you so much. Oh, I think you're referring to the sharp pain. I think what you're saying is the sharp pain is what you got 2.5 years ago. Okay. So nerve pain has qualities that fall in the following areas. So nerve pain can give you burning pain, or nerve injury can create pain. All right. And the qualities of pain can be burning. Sometimes nerve injury can give you sharp, stabbing, burning, piercing, or electrical pains. All right. So when I hear somebody that's got sharp pain all over the body, I'm thinking of neurologic injury, potentially from the infections. All right. So in thinking of what to do for neurologic injury, I want to make sure to treat if somebody has it for their Lyme and their Bartonella, because both of those can injure it. If you've been treating and the neurologic injury seems to be getting worse, then there's some additional steps you want to take. One would be to look and make sure you don't have mold toxins in you, because they can alter how well the nerves work. The other thing would be to do some basic laboratory testing, and that would be to look at things like vitamin B12, vitamin B6. B6 is something people take for neuropathy, but if you take too much of it, it actually can be neurotoxic and lead to a problem. So you want to get B12, B6. You want to do thyroid testing, make sure your thyroid levels are good. Somewhere along the way, somebody should have looked at and see how your kidney and liver are working as well too. Okay, so you want to do some basic testing to make sure there isn't something that's reversible there. All right. Can this go away with treatment? Yeah, it may take time for it to go away, but it can go away. And with that kind of pain, in addition to killing your germs and removing toxins if they're there, the other thing I would do with my patients is I do nerve support and mitochondria support treatment. So all those things I was just talking about tonight for mitochondria support, mitochondria repair, you would want to do as well too. Okay, so I just published an article last week on this one too. I actually went through a period where I was creating new information for all of you, and one of those was my neuropathy article. Let me show you where you can take a look at that. All right. So again, if you're ever wondering what's the latest things I wrote, just come over here. You hit this latest tab here, okay? And take a look at this article called Peripheronopathy Evaluation and Repair in Lyme Disease. This is where I walk you through what testing do you do and what do you do to fix it, okay? And in answer to your question, yeah, it can resolve. It may take a little bit of time, but it can resolve. Let's see. Oh, there we go. All right. Good luck to you, Julie. Let's see. Hello, Dr. Ross. Does one have to consider extra mineral and vitamin supplementation while taking binders like activated charcoal, bentonite clay, and cholestyramine? What is the longest amount of time you would consider having a patient on a mold protocol? I'm predominantly concerned about mineral deficiency caused by binders. So Anna, the only one that I have become aware, and this is actually a newer awareness for me, that may lead to mineral loss of minerals is the activated charcoal. not the bentonite clay and not cholestyramine, but the activated charcoal may remove minerals that are very useful in hair growth. All right. So where I'm starting to see a problem with it is in some of my patients that have been on it longer, they start getting into hair loss. For hair loss, I will do another evaluation. I'll do thyroid testing. I'll look at iron levels. But if those are normal, I recently learned from a dermatologist that I had to get involved with one of my patients that she thought it might be due to mineral loss from the charcoal. Okay, so that was an eye opener for me. And so I have modified my treatments. These days, if I'm going to have somebody on a binder and I anticipate 6 months or more, I am putting people on something called Core Minerals, which is a product by Research Nutritionals. I have them take 2 pills twice a day, especially if they start having hair loss. Okay, that I might definitely do it in that kind of situation as well too. In terms of how long does it take to get rid of mold toxins, it's usually a 6-month process. Sometimes it can take up to a year, and it all depends on the person. Okay. All right. Good luck to you, Anna. All right. Let's see. Hello, Patty. Do you think it's wise for Lyme patients to get the COVID booster? So at this point, I'm not quite sure yet. I need to see some of the data that's coming out as to whether this is going to be a good idea or not. And I don't know. I honestly don't know. I don't know for sure. I'll put it that way. My sense is it probably is going to be a good idea. But to give you a definitive answer, I need to see more of the data. And I haven't seen that yet. Okay. All right. Thanks for the question, Patty. Hello, Patty. Let's see. Antimicrobials cause candida overgrowth and was told to take nystatin for 1 month, then to continue Lyme treatment. Won't Lyme treatment just cause yeast overgrowth again? Do you agree with taking nystatin for that long? How do you stop the yeast cycle? Okay. So Patty, I answered a yeast question earlier tonight. My preferred treatment would not be to use nystatin alone. I don't think it'll take care of it. And I would actually prefer to use diflucan with nystatin. But listen, I'm not going to go through the whole thing again with you here because it's a similar question to what I answered earlier tonight. Take a look at the recording tomorrow. The other thing I will steer you to take a look at, well, actually, I will answer it at a different angle on your question, though. Being on antibiotics is going to predispose you to yeast coming back. It's very true. So what I like to do with my patients, all my patients that are on treatment that are on antibiotics, I like them to be on probiotics to repopulate the intestines with good bacteria. Okay. The other thing is I like to have them during treatment, the whole treatment. I like to have them either on a nystatin to help swat down yeast as they come up, or I like to have them on an herbal anti-yeast medication like a Capri Plus, 2 pills twice a day to help swat down the yeast as they're coming up. Okay, so probiotics and a mild yeast killer I like to do. Okay, but if you've got too many yeast really growing, that nystatin is going to be too mild to get rid of it. You need to use something stronger, and I prefer using diflucan with that. Let me give you an article that you can take a look at here again. All right, so let's take a look at, this is my yeast section again. Take a look here at this Kills Yeast, a brief guide where I walk you through the ways to take care of yeast, okay? All right. Thanks for your question, Patty. Good luck to you. Hello, Lynn. Let's see. Does the immune system produce antibodies to persisters or only when it sees active forms of a germ? In other words, is there a scenario where you could be symptom-free, have a clean antibody test, and still be harboring Lyme or Bart persisters? So I'm gonna say yes to that, but I'm going to take it one step further. All right. So I know there's a current trend among some of the providers that are managing Lyme disease to do testing to see if you're done or where you are in a treatment. And I will tell you, it's not accurate. There are no studies that have ever been done showing that the level of antibodies that you have correlates with the actual germ load from either growing or from persister forms of the germ. All right. So one of the things that can happen is your immune system may stop making antibodies because it can't see the germ. And in one ways it may not be able to see it is Lyme can live in places that don't have good blood flow. Another reason your immune system can stop making antibodies is because of immune suppression, where the immune system just gets overwhelmed by the germ and just stops making antibodies, all right? I haven't seen any data that looks at the part of the question you're looking at, which is, do persisters trigger an antibody reaction? I don't know. I haven't seen anyone look at that question. I would think they probably do, but I haven't seen any data on that. I don't know that anyone's looked at that question, okay? But because the Lyme can sequester itself in a way that antibodies can't see it, or because excessive Lyme, where Lyme is raging in you, can suppress the immune system, causing you not to make antibodies, retesting and looking at antibody levels is unreliable. I don't do it. And I'm actually quite surprised by a lot of my colleagues that are doing it these days. But I don't find repeat testing to be useful. I think you have to look at clinically what's going on. And also, if somebody's not doing well, you also have to, besides just automatically assuming it's Lyme, you also have to see, is there anything else that might be triggering some of the problems as well, too, if somebody's not getting better, okay? Like chronic virus infections, for instance, okay? All right. Good luck to you, Lynn. Let's see. Hi, Dr. Ross. Thanks for taking my question. You're welcome. Let's see. How do you treat Bartonella in someone that cannot tolerate rifampin? My daughter gets nausea and vomiting every time she restarts the rifampin. All right. So rifampin is not the only drug that works. I mean, rifampin and rifabutin are in the same family, and they're medicines that a lot of people are using, but there's other ways. Basically, to get rid of Bartonella, you want to be on at least 2 antibiotics if you're going to do prescriptions that get into the intracellular space, get inside of cells and inside of Bartonella. All right. So intracellular drugs are Bactrim, the macrolides, which include azithromycin and clarithromycin, which is Biaxin, for instance, and the tetracyclines like minocycline, doxycycline, and tetracycline. All of those are intracellular antibiotics. So if I've got somebody that can't tolerate a rifampin or the brother-sister rifampin called rifabutin, I might do a clarithromycin with doxycycline. I might do a clarithromycin with Biaxin. I might do a doxycycline with Bactrim. So there's some alternatives that you have there as well, too. The other thing to look at is you could take one prescription antibiotic and combine them with herbal antibiotics. So you could do like a clarithromycin with Sida acuta and Hutania could be an option as well, too. All right. So I list out some of these options for you to consider in my Bartonella treatment article. So let me just show you that again in case you missed it earlier tonight. All right. So again, take a look at my infection treatments plan section here. And take a look at this article called Kills Bartonella, a Brief Guide. And what you're going to see here is give you some options, okay? And so you could do like a rifampin or rifabutin plus azithromycin, clarithromycin. And then I also put in here things you would use to treat persisters, okay? Now, because you can't do that, then you might want to look at azithromycin or clarithromycin plus doxycycline or minocycline. Or you could look at azithromycin plus Bactrim. Anyhow, there's options that you can do. Take a look at this. I give you them right up here. Okay? All right. All right. Thank you, Katie. Hello, Kim. Let's see about glutathione. How essential is liposomal? I've been taking it, the watermelon one from your store, but don't feel any difference from when I was taking the pill form. And it's a huge price difference for me. Can I take the pill form with similar benefit? The data that I have, and I'm only gauging this upon data. The data suggests that that liposomal variety from my store, the Research Nutritionals product, has really good absorption. I would need to know what the pill form is that you're trying to compare it to, and see if there's been anyone that's done studies comparing the effectiveness of the two. But I can only talk about the liposomal variety, which does show good absorption. And generally, if it's not a liposomal variety, we just don't think they're well absorbed. The data would suggest they're not well absorbed. Okay. All right. Thanks, Kim. Hello, Amanda. Let's see. Thank you for these webinars. Very helpful. You're welcome. Let's see. I have Lyme co-infections, POT, ANA, RNP, and immune deficient. I was exposed to black mold in April, and my C4 was over 1100, and my urine kit came back positive for black mold. I was highly symptomatic with red hands and soles, hair loss, increased leg paralysis. We left the premises for 2 weeks while the owners, quote unquote, fixed the issue. We returned to the house, and over the subsequent months, my symptoms returned, but worse this time. My red hands returned, hair loss, only this time new symptoms started with recurring butterfly rashes. Let's see if I can find the other part of your question here. Well, Amanda, unfortunately, I don't have the rest of your question. It didn't show up here. The one thing I would just make an observation based on what you said. So getting mold out of a house is hard. And even though you get a good remediator in there, they may have missed something. I question if you may still have some in that house, even though they're remediated, unfortunately. You may want to see if you get an inspector back in there again. And if you keep reacting in that house, even if they tell you it's clean, you may want to start looking at a different place that is newer with less of a chance of having mold in it. Okay. All right. Sorry about that. All right. Good luck to you, Amanda. Hello, Eileen. Let's see. Thanks so much for all you do for us. You're welcome. My husband and I have been battling Lyme, co-infections, and yeast for several years. We are using your protocols. Our absorption of vitamin D3 from supplements has dropped. We are taking probiotics and spore biotics. Would the fight against Lyme, etc., as well as yeast inhibit our absorption? Thanks so much. Good question. I haven't seen this happen before, so I don't know. I actually don't know off the top of my head. I'm not sure how to respond to that. I would have to look into it to see. Okay. All right. Good luck to you, Eileen. Hello, Crystal. Let's see. Hi, Dr. Ross. This is my first Q&A webinar with you. Welcome here, and thanks for taking a bold move and writing a question there. That's good. Thank you for offering this. I have a question regarding IGeneX testing for Lyme and multiple co-infections. It was recommended by a naturopath, and I've read on several Lyme support group sites that testing is more likely to be positive if flaring up, i.e. getting the bacteria out of dormancy. Kroger Candida Formula 2 was recommended. I was wondering if you recommend waking up the bugs before testing, and if so, what are the most effective recommended methods to do this? Would PEMF therapy using the Beamer machine do this also? So It's a good question. I mean, one of the things that happens with Lyme, as I mentioned earlier tonight, Lyme doesn't live in areas of good blood flow. Oxygen in your blood is toxic to Lyme, and Lyme likes to survive. So it moves into areas that don't have good blood flow, which makes it harder for the immune system to have an adequate immune reaction. Okay. However, that doesn't mean you necessarily need to do anything to activate the immune system. So the idea that some people will do, and I'll do this sometimes, is, so what I would do in a situation like this, I usually will get the Lyme testing done first. And if I get a test back that's indeterminate, then I may have a person take either prescription antibiotics that target Lyme or herbal antibiotics that target Lyme and use them for at least a month and then repeat. The idea would be is if you do kill for about a month, that will kill Lyme germs, and then the tissues release those Lyme germs into the bloodstream where you can have a stronger reaction. Okay. I do not know that the Beamer or PMF would do that. I just don't know that it does that adequately. I know antibiotics do, and I know herbal antibiotics do. The Kroger Candida formula, I am very doubtful if it would do it because it's a Candida formula. And generally the things that we're using for Candida are not effective at killing Lyme. Now, I don't know that specific formula, but usually things that are called a Candida formula are not designed to kill Lyme. Okay. All right. Good luck to you. Hello, Diane. Let's see. Artemisia. Good to use 3 days and then off for how long? All right. So Artemisia, artemisinin are all from Chinese wormwood, right? And they are effective at treating malaria. In fact, are recommended by the World Health Organization for that. But also they are can be useful in a Babesia treatment. The trouble is after using them for about 3 days, the liver does develop an enzyme that can deactivate it. Okay. And so what I have found most useful is to use these wormwood derivatives, whether it is artemisinin or artemisia, at high doses for 3 days and then be off of them for 11 days. That's a regimen cycle that I have found effective. Okay. All right. Good luck to you. Hello, Kelly. Let's see. Hi, Dr. Ross. My daughter has been on ATP 360 for about 6 weeks. We are seeing a definite improvement in fatigue, maybe 70%. How long should I expect to keep her on it? Wow, that's a good improvement. It's often usually not at this level, at this soon into it would you see that kind of improvement. So that's a good sign. Okay. Generally, what I found in my practice is ATP 360, which are using to primarily repair the covering of the mitochondria, although it does give you some micronutrients to help your mitochondria work well too. And again, mitochondria are the power factories in our cells. Generally, that repair process is about 6 months. So I usually like to have my patients stay on it for a total of 6 months. Okay. All right. Good luck. I'm glad it's working too. Hello, Sai. Which of the infections creates intermittent high fevers and high white blood cell count? So when I see high temperatures that come up periodically, I'm thinking more Babesia, although Lyme sometimes can too. Okay. Same with the white blood cell count. All right. Good luck. Hello, Kate. Let's see. Does fluconazole make other yeast more virulent? Also, have you ever heard of anyone being allergic to Candida? I think I have this because I have chronically congested ears ever since my killing protocols. Thoughts? My Ravenous was 28 on an O test. All right. So So everyone, arabinose is a chemical that can be released by yeast. It's an organic acid, and there's a urine test you can do that measures organic acids. And so it is one of the tests we can do that might indicate you have yeast. However, you can still have yeast and have normal O testing. But if it's elevated, it definitely suggests that the yeast is there. Okay. Can you have allergic reactions to yeast? Yeah, and a lot of people do. So for instance, I've got patients that when their intestinal yeast is really active, will wind up having a lot of nasal congestion and snottiness, and they might even have asthma gets really active. And then we get rid of the yeast, and often all those symptoms resolve, okay? Now, if you treated your yeast and you are still having some increased sensitivity, it might not just be to the candida. It could be that having had intestinal yeast overgrowth, it triggered you to have leaky gut syndrome. And in leaky gut syndrome, the cells that line the intestines plump up and pull apart, creating gaps, which lets various kinds of food items leak through and hit your immune cells, triggering more allergic reaction, all right? So even when you get the infection out and those cells start to heal, it can be a 6-month process before everything gets back to normal. You might want to consider experimenting with something called an elimination diet, where you remove anything that anyone has found, or the majority of things, you remove a majority of things that people have found to give allergic food reactions. You remove them from your diet for about 3 weeks, and then you slowly start reintroducing them one at a time and see if one of those really triggers a strong reaction. Okay, it's one way to learn, okay? I'll do a screen share here. I'll show you how to do an elimination diet. I have an article on that. All right? Okay. Good luck to you. Let me just do a quick screen share here. All right, let's see. All right, so take a look at, there's a section I have in my site called nutrition. And take a look there and look at this article called Elimination Diet to Find Problems. Okay, all right. All right, everyone, here we are, we're done. I only have 3 more questions left, but anyhow, that's a good night. I actually was able to get through most of them. Good to have been here with you tonight. I hope you got some information that's good to help you, and look forward to seeing you here again next week. So keep your eyes out in your email tomorrow morning. You will get an email from me telling you that the recording is ready, and it will include information about how to sign up for next week, okay? And I invite you to share that information so other people get this information as well too, okay? Good night, everyone.